Hello everyone, it's Dr. Kerry Yerkew. Thank you for joining me today for this webinar. We're going to be talking about neck pain and giving you tips on how you can better manage your neck pain. So we do webinars here on Wednesdays in the clinic, and feel free to join us for upcoming webinars. We're usually booking up to 6 weeks in advance for our webinars, and they're done on Wednesdays primarily at 12 noon. Today we're talking about the 3 best ways to get rid of neck pain. So we're going to give you some tips. We want to provide some better understanding of neck pain and what we can do to help you. I've been practicing for over 25 years, and I've seen thousands of patients in the clinic. I've done over 100,000 adjustments to the spine, including the neck, as well as other joints in the body. I practice at the Landmark 4 building, which is the tall glass towers in Kelowna, and currently we are accepting new patients. So what causes neck pain? We want to talk about that today. And for causes of neck pain, injury is a major cause of neck pain. Poor posture is a cause of neck pain, and arthritis. So these are among the top causes of neck pain that we see in the clinic. For injury, usually it's related to something like a car accident where there's a whipping motion of the head and neck, and there's trauma to the tissues that can leave the neck with restricted movement, pain and discomfort, inflammation, as well as a misalignment or poor posture of that area. Sports injuries can have a similar effect, but a little bit different mechanism of injury. So instead of a whipping movement, sometimes there's just a trauma and a movement to one way. Sometimes it can be sideways versus front to back. And so sports injuries have an effect on the neck area. And then falls on the ice, tripping and falling can cause injury to the neck area. As far as poor posture, we see people that are slouching, their head's forward, their back is rounding, people that sleep poorly, so they sleep in an irregular position. It causes a kink in their neck, something like a wry neck or a torticollis, or even work with repetitive strain with the monitor not at the right height, or people that are working, let's say like a plumber that is working in tight positions and straining their neck and causing the neck to either go out of place or cause sprain and strain to that area. For arthritis, there's 3 main types that we see in the clinic. Osteoarthritis is the most common type. Rheumatoid arthritis is second most common, and then psoriatic arthritis. And these are different types of arthritis we see. Osteo being more of a bone type where the bones get rusty and start degenerating. Rheumatoid's more of a systemic inflammatory condition that several joints are affected, and psoriatic arthritis is connected to psoriasis. So tips, what tips can we give you as far as helping you with neck pain? Number 1 is to go and get checked by a chiropractor. There's nothing like getting a proper diagnosis, understanding your condition better, and then getting the right help. So I would encourage you to go to your local chiropractor. If you're in Kelowna and you're looking for a chiropractor, you can contact us. We'll give you some information at the end of this webinar. Getting the right posture and supports for your posture are important, and then movements very important to help with neck pain. So when you go for a checkup, what a chiropractor will do is they'll do a history, they'll do an assessment on you, they'll take x-rays if necessary, and then they're going to give you the proper diagnosis. So basically, they're going to tell you what the problem is and what they can do to help you. For posture, we're going to look at the posture from right to left and front to back. So we're going to look at it in a multi-dimensional plane. And then we're going to recommend things like proper supports like mattresses, work positions, proper pillows, things you can do to better support your posture. We'll give you stretches and exercises, things like yoga stretches and exercises that are very effective for the spine. If you keep moving, it'll keep the fluid circulating in the joints, and that brings better nutrition to the joints. If you're eating healthier, have a better diet, that nutrition will help the joints to be healthier and stronger. And for strengthening, you can do stretching like yoga, and then strengthening like core strength that a chiropractor can advise you on. If you're interested in an appointment in our clinic, you can click on the link below. For the initial visit, if you book online, we're offering you $15 off the first visit. If you're interested in the book I wrote on neck pain, it's on Amazon. And if you just type in Dr. Kerry Yerkew and neck pain, you're going to find that book. It's in paperback, ebook, and audiobook. I did write a book on back pain as well. So if you're interested in this book, it's in the same three formats. We've got the paperback, ebook, and the audiobook. We do many webinars here on Wednesdays, primarily at 12 noon, sometimes in the evening. And these webinars are on conditions like joint pain, headache, sciatica. We do talk about foot pain and extremities, like hand pain. So these webinars vary, and they're based on the different conditions that we see in the clinic. You can follow us on social media at Dr. Kerry Yerkew. That's my handle on Instagram, Facebook, and Twitter. You can also get our podcast on Android and Apple, and it's called Super Healthy. So if you go to your favorite podcast provider, let's say Spotify, you'll be able to get Super Healthy on that podcast provider, and you can sign up or subscribe to our channel. Similarly, you can subscribe to at Dr. Kerry Yerkew on YouTube, where we stream live webinars like this, and then later they're available for viewing as they're recorded. For our website's www.kerryyerkew.com. You'll find out more about the clinic and more about me there, as well as you'll have an opportunity to book an appointment. And if you want to do that, again, you can go to the link below. You'll get $15 off your first visit. And usually we can see new patients within 48 hours. So if you'd like to get a new patient appointment, we'll get you in within the next 2 days. And this offer is good for the next 2 weeks. So please feel free to click on that link and take advantage of this opportunity. So I want to thank you again for joining me today here at our webinar. Please join us for future webinars, and I hope to see you in the clinic soon.